Welcome to the Owning Your Sexual Self podcast. I'm your host, Rachel Main, awesome wife and dog mom for life. I'm a sex therapist turned sex coach, and I run a successful business selling relationship enhancement products. I absolutely love talking about all things sex. So you can expect this podcast to explore all things related to women's sexual health because that's what I'm here for. I'm here to help you discover and embrace what brings you pleasure so that you can own your sexual self. If that sounds good to you, then keep listening and let's fucking do this. Welcome back to the Owning Your Sexual Self podcast. I'm very excited to have on our guest today, Amelia Ponchur, all the way from Dallas, Texas. And Amelia is a pelvic health professional. So today we're going to be talking about the topic of painful sex and how a pelvic therapist could help with that and also in collaboration with a sex therapist. So thank you so much for being on today.
Thank you for having me, Rachel. It's so nice to be here and chat about this with you.
Absolutely. The wonderful world of Instagram, I swear, bringing all of us professionals together. And we would have never crossed paths probably in our life had it not been for that.
No, totally. I know. I love it. It's a great way to connect with everyone else in the sexual wellness world. So it's awesome.
Yeah. So in your practice, tell us a little bit about your day-to-day work with women's sexual health.
So I'm a pelvic health physical therapist, sometimes called pelvic floor physical therapist. But our practice here at Genesis PT and Wellness, we have an occupational therapist and then 4 physical therapists right now, but we're kind of in the midst of expanding, which is exciting. But we kind of help with anybody who has a pelvic floor, really. So we see men too, but I would say obviously 95% is women, and most of them are prenatal, so they're pregnant, or postpartum phase. That is a big chunk. But people who have never had babies or don't plan to, or even they're just older and that's way past them, we treat them as well. So anybody who feels like they're having issues with bowel movements, constipation, hemorrhoids, urgency, extra frequency of going to the bathroom, any leaking, incontinence, painful intercourse, of course, and then just kind of general pelvic pain as well. I mean, it could also translate as being hip pain, back pain, pubic bone pain. Honestly, we're just orthopedic, regular day-to-day PTs, but we just add in this extra component of pelvic health. So I feel like painful intercourse is one of the larger instances of problems that we see. Mm-hmm. And so it's just nice to have people like yourself who are sex therapists or in the sexual wellness world to kind of have them see as well in conjunction with pelvic health therapy. So, I don't know if that answers your question, but that's kind of the basis of who I'm regularly seeing every day. And I feel like I see at least 1 or 2 people every day who have painful sex. So that is definitely something we're treating and talking about often.
Yeah. And this question always comes up for me when I talk with people in your profession is the majority of people coming in for something that is not sex related. And then when they get in, you're opening that door for them to have the conversation about painful sex.
Yeah, it's a great question. I can think of one patient that I'm seeing right now who came in with the main concern of she had a baby and now she is unable to have intercourse at all. It's super painful and it's really affecting her relationship. And we've talked about therapy and all the things there, but it is rare that somebody straight comes out telling me that they have painful sex. I kind of have to probe that question out of them. Because in general, this is an uncomfortable atmosphere for them, just a gynecology exam. It's not people's favorite thing to talk about or do. So, they generally come in with problems of I had a baby and I'm having low back pain. And then in the midst of my questions, I ask, have you tried intercourse yet again? Or how is it going? And then it really snowballs out of we haven't tried again because the first time we did and I was crying, I was in so much pain or, something to that effect. But I feel most of the time I have to pull it out of them.
Yeah. And I'm glad you brought that up because that's where the sex therapy piece would come into play. So if they did have sex afterwards, they had that, what we would categorize as a traumatic experience. And I feel when I say trauma, so often people are what do you mean it was trauma? I wasn't raped, I wasn't in a bad car accident, but trauma can be on such a large scale and spectrum of things. And if a person is going to have sex, they feel that pain. Just the same instance if you touch a hot stove, right? And you get that reaction. It's okay, now I know I'm not going to touch that hot stove. So same thing with sex. We get that feeling in our minds or that thought in our minds that, okay, if I go to do this again, I'm going to have the same experience. which may be the case, but I'm sure the longer they put that off without, stretching that tissue, moisturizing that tissue and things like that, the worse the pain is going to be the next time they go to have sex.
Yes, and totally. Even if they're not, like you said, even if they don't think like, oh, that was traumatic, like their nervous system thinks that it was traumatic because it sent that pain response. So like in a subconscious level, they are fearful of it, even if they're not verbalizing that. And so like reducing that stress and anxiety and fear with it, along with like the physical pain of it, is so important to like go in conjunction with one another. Mm-hmm. So yeah, I agree. It's super important to chat about and to like get them to get in the right mindset physically and mentally about like trying to do that again.
Mm-hmm. Yeah. So if somebody comes in and their complaint is painful sex, what is your first approach to working with that patient from like the physical component of things?
Yeah, it's a great question. And I feel like everybody in the physical therapy world always says this, but it totally depends. Everybody's mm-hmm. situation is so different. And the pelvic floor is so convoluted in that, as I'm sure you know from talking to like so many different pelvic physical therapists at this point, but it can have so many different issues going on with it based on literally everything else going on in your body, right? Like we talk a lot about like how you're breathing and how that affects your pelvic floor, and then like what are your feet doing and how are your hips moving, and just kind of like all the different components of like body motion movement patterns. But then also what is their pelvic floor, what is its natural response? Is it to be tense and tighten up and just kind of hold that tension all the time, or is it because it's just like weak and doesn't know how to move through its full range of motion? Could it be both? Yes. So it's always figuring out like what is their response? What is their fallback in their pelvic floor? So if it's somebody who has like a tight or tense pelvic floor, that fear and anxiety, kind of like getting it to stretch and learn how to relax the pelvic floor, like physically and the mental component too. But that would be a big phase for them. So we'd work a lot on like, finding that awareness of your pelvic floor is the first part, because nobody teaches you like how to do a Kegel mm-hmm. or how to relax after a Kegel, which is like the super important part. But nobody talks about those things. And so we kind of have to like go through this whole thing of like, what are we talking about when we're talking about the pelvic floor? How does that relate to your core and your breathing and your movement patterns? And then, how can we get you to feel that awareness so that we can learn how to like really stretch and relax it and disengage it, basically, is kind of that issue. But on the other side of things, if it's weakness, then yeah, like Kegels might be a good option, but that's not the only way you strengthen your pelvic floor. It's how can we advantage your body movements to get your pelvic floor into that strengthened or that like more tense state. And so what that feels like again, so how to do a contraction. And that's usually like the main starting point is like breathing and like, do you know what a Kegel is and how to relax after a Kegel? Because I feel like 90% are like, I don't know what the hell a Kegel is. Like, what are we talking about?
Mm-hmm. Yeah.
So it's always just, that's a good starting point.
Yeah. I love that. And when the people are coming in, they're stating that there's pain. Are there questions about the type of pain? What is like having them describe the pain? And then when people are able to do that, is that helpful for you as the clinician to help almost like diagnose what treatment would be best for them?
Yeah. Great question. So yes, yeah, I typically say, like, it's also hard for these people sometimes because they like are trying to relax or be in the moment or like try to get more aroused or whatever. And so they're not fully thinking about what's happening. They just know it was pain. So then I'm asking them all these specifics and they're like, crap, I don't know. But when they can't describe it, I'm kind of like, is it feelings of like dryness or rawness? So do we have like an estrogen issue? Mm-hmm. Is it potentially pain with penetration to where we have like a problem with the pelvic floor, like tensing up and being too tight at that moment? Or is it pain with like deeper penetration? And what does that feel like? Because that could relate to something like scratching, something I've heard, or like sandpaper feelings. Mm-hmm. Or is it like burning and sharp pain? Because this can kind of tell us, are there like knots in the muscles or like trigger points that need to be worked out? Or is it more about like positional issues? Like, do we need to talk about changing positions and maybe you're just at a better advantage when you're more in control of where you're at, and your pelvic floor can relax a little bit better when they're in a more controlled position, mm-hmm. if that makes any sense.
Yeah, absolutely.
And that kind of helps guide our treatment and like talking about things that they can do to help, or if it's something that like I need to intervene on if it's not just like, oh, maybe we need to get an estrogen cream because, you know, dryness can be about low estrogen production? Or is it like, maybe you're just not using enough lubricant? Or is it like, truly your pelvic floor is not doing what it's supposed to?
Mm-hmm. Yeah. And there's so many different things that it can be. And that's why I love having a variety of people like you on the podcast, because you have to hear it so many times, because I know there's still women out there that are listening, they're regular listeners that are having painful sex. And even after having all these guests and talking about this repeatedly, they're still like, I don't know. So sometimes it's like, it just takes hearing it from somebody different or hearing it said in a different way that it finally will click for them. And, I asked about the pain specifically because I remember early on in my schooling, one of our instructors was telling us about dilator therapy, and she talked about this thing called the Q-tip test. And I remember thinking this, and I was like, okay, so how she described it was somebody that's coming in for pelvic pain, they will take a Q-tip, it's a lubricated Q-tip, and they would basically place it on the vaginal opening. And so to help that patient be able to describe what that pain is feeling like, where it's located, and take them more through that moment in that safe place, to be able to really fully help describe that pain. Because as you said, it's very hard oftentimes for us to be like, I don't know, it just hurts, right? And also not using correct anatomical terms, right? Like you say, my vagina hurts, but is it actually your labia or your clitoris, or, you know, and your just vulva in general is throbbing. And so I loved hearing that, and, you know, starting with something as small as a Q-tip, and if there's pain there, you know that at that point, like, you're not going to recommend for that patient to start using something like dilators right away, or you maybe take penetration sex off the table for now and start exploring other things sexually. But yeah, so that just popped in my head when you were talking about that, and in helping people be able to describe their pain even better.
Yeah, that Q-tip test is actually, like, I feel like that's what we do all day long, because, you know, like, one digit is different than, like, a penis. And so, yeah, in a pelvic health exam, we're using one finger. Some therapists use two for certain different things they're looking for. But, yeah, it's definitely different than, like, a speculum at the gynecologist or, like, a penis, because all those sizes are so different. So, yeah, dilator therapy is definitely something that we talk about a lot with our painful intercourse patients. It's definitely not something I typically immediately start to refer to. Mm-hmm. Not because it's bad or anything, just because I'm like, you know, for some people that can be like a big, not like mental barrier, but it's just not like their favorite thing to want to try, because that's kind of all on them to practice at home. We just kind of guide them through like good dilators to use, how you're going to go about doing it, how to progress through using the different dilators. But yeah, I feel like most times, I would say most times, people who are having the painful intercourse because of like vaginismus, which is, you know, where the pelvic floor is just kind of tense, it's usually not like my one finger that's bothering them during a pelvic exam. So we're not always getting that same pain response. And that's like, okay, so maybe it truly is just like a size issue. And then there's also like the O-nut thing. I don't know if you've heard of that.
Please tell us.
The silicone. Oh, you haven't heard of this?
No, okay. I don't know.
So it's, you should look it up. It's very interesting. I just found out about this not that long ago, but this is a good tool for people who have, they're able to orgasm. So it's not an issue of like their pelvic floor functioning in that respect, but it's like the deepest penetration of their partner is not comfortable for them. And so this like O-nut is a like kind of silicone ring, if you will, and it's got different sizes to the rings. So some of them have like 4 rings on them, so it's longer, and then some have just like 1. And your partner would put it on like the end, like the furthest down in the shaft of his penis. Mm-hmm. And so when you're having sex, you only go to the amount of penetration that you can handle, so that you're still able to orgasm. You're both still able to have like pleasurable intercourse. And it's like a really good tool for those types of patients to get past that fear and anxiety aspect of sex, mm-hmm. because they can have comfortable, pleasurable sex to a degree that's comfortable for them, and it forces, or like lack of force from their partner, to not go so deep to the point of pain.
Yeah.
So there's some really great tools out there, like the dilators, and wands and the O-nut and like all these things to help you. And I think that's wonderful, because this stuff did not exist for people who had pain with sex, 15, 20 years ago.
Yeah. And the company that I work for, so Pure Romance, so I'm also a bedroom accessory distributor and a consultant for them. And we have, so what you just described, we call it just our penis ring set. But basically it's like these stackable gray rings. They're literally $12, like very affordable for people. But I like how you said that it almost like creates like a buffer for them so that the penis can only penetrate so far. So for somebody that's having that deeper penetration sex that's being painful for them, that I never even looked at it like that. I always looked at it from a pleasure component. So I'm so glad that you just talked about that, because that's a great thing for people to be able to pick up.
Yeah, because we still want them to have that orgasm. Like, that's great for your pelvic floor because it's literally a spasm of that third layer of pelvic floor musculature. So the really deep, big layer, the one that's really important to like help you have a bowel movement and push out a baby. And so we need that to be working for you. And it's like a car wash for your bacteria in your vagina too, right? Like, it just kind of cleans everything out. It's just like orgasms can only help. So we want people to be able to do that. And if the deep penetration is the only part of that sex that they're having pain with, it's a great tool to use for that until we can like figure out all the other issues as to why it's painful. Yeah.
I need to take a moment and let everybody know that's listening, like, you have a medical professional on here that is encouraging you to orgasm more and often, because it's so, women are just so like, oh, I don't, like, what do I say? Do I talk about that? You know, it's uncomfortable. It's so taboo still to this day. And I just, you saying that, I'm like, yes, so she's pro orgasm. Like, I need to reiterate that for everybody to hear.
Yes, it's awesome. We need it.
I love that. And you mentioned another thing too, using a wand of some sort. And so that's another thing that we have many in our catalog, and something personally I'm a huge fan of, again, for people that are experiencing pain with any sort of penetration. So when you're talking to your patients about that, how do you recommend that they incorporate things like that?
Yeah. So again, wands, like, we love. Like, I've seen the ones that you promote, they look great. We like the ones that are kind of like bent, you know, you can kind of like get in and out in different directions and kind of like stretch the tissue and hit kind of those knots in their muscles. So for people who we have found, like, knots in their muscles are really like the only large issue with why they're having discomfort or any issues, especially with painful sex, like, wand therapy is great for them to use. You know, you just kind of put some lubricant on it, or like the silicone based ones you don't even really need if you don't need to kind of just target those areas. And we just kind of basically teach them how to do proper diaphragmatic breathing and using that wand and breathing in conjunction to kind of help those knots settle down. And you do that, you know, a few times a week or every other day, whatever the therapist tells you. But it can be really helpful, again, for like that dyspareunia, that painful sex, to kind of calm everything down. And it kind of gives them the tools to control it. Because again, sometimes it's uncomfortable when somebody else is doing it for you during a session. And I feel like a lot of times our patients get past that, but there are some that, you know, they're still like, this is not my favorite thing in the world. And if they can control it on their own, it's great for them to be able to do it at home on their own terms. Yeah, absolutely. And one other thing I wanted to ask too, because you're mentioning a lot about essentially the pelvic floor being too tight or being too stressed. And that is, when I first started this podcast and having guests on, that is a very common thing that I hear. However, on my line of the field, I feel like I'm experiencing more with people that their pelvic floor is weaker. And so I'm always pushing Kegel balls and dilators and things like that. But it's worth noting though that there's this whole other side of the spectrum, that it could be in fact that your pelvic floor is too tight. It's not actually too loose like you may think. And so is there any indicators that somebody could go through to know, okay, I'm either too loose or too weak? Is there known differences between the two? Yeah, it's a great question. I would definitely just say, like, seek out a pelvic floor physical therapist. That's the easiest way, is just to have somebody else tell you. Because again, there's other components to all of this, but I would say the main things are, it's based on how you're breathing and what your hip rotation default is. So we have what's called internal and external rotation of our hips, and each direction kind of coincides with a pelvic floor relaxation and a pelvic floor contraction. So if you think of like a really deep squat and you go all the way down into the squat, like you're able to get like butt to heels and relax there, your knees are pretty spread out, right? That's kind of an external rotation motion. And at that point, your pelvic floor is just like totally hanging out, relaxed. It's love and life. That's a great pelvic floor stretch right there. Mm-hmm. So if this position is comfortable for you, you can get there and hang out there easily. Typically that means like you know how to get your pelvic floor to relax well. Now, not everybody is like that, but that's just one example. And if you're somebody who can't hang out in that position very often, your pelvic floor doesn't seem to be comfortable, like the vaginal area feels really tight, then you might have a super tense pelvic floor. And so your problem could be that it still could mean that it's weak, but it could also mean that it's just really tight. So that doesn't necessarily mean that it's strong. It could be tight and weak because it's tired from being up there and tight all the time. So that can be an indicator that it's weak if you can't last in that position for a while, or it's not comfortable for you to linger there, if that makes sense.
Yeah, I immediately want to do a squat now to see.
Yeah, you're like, nah, I'm just going to see.
Yeah, now I need to know.
Yes. But in general, I would say that most people with issues like prolapse and incontinence or leaking, those two groups typically tend to have weak, tired pelvic floors. But again, that's not always true. It's just most of the time a weak pelvic floor is all about a pressure management issue. Their body just can't handle those quick changes in pressure or just the daily pressures of gravity and extra body weight while they're exercising. And so it gives out, and what happens is urine leaks through because your pelvic floor is, one of its job is to stabilize and support all of your organs. And, you know, in order to urinate, your pelvic floor has to relax. So typically, if you're urinating when you're not supposed to, that means your pelvic floor isn't holding that urine in like it's supposed to. So it's kind of letting it go when it's not typically meaning to.
Yeah. It's very helpful. And yeah, that's typically the women that I come across, you know, when I'm talking about Kegel balls and stuff like that. They're like, oh yeah, like trampolines, my worst nightmare, sneezing, laughing too hard, anything like that. Don't sign me up for those sorts of things. Yeah, I love that you said that. That's a pretty good indicator that you're going to fall more in the weaker pelvic floor spectrum. But I think, yeah, I'm glad the squat thing. So aside from feeling pain in like your hamstrings from being in that position, that's normal. That doesn't indicate anything from the pelvic floor. You want to focus really on that like vaginal pressure that you may or may not feel.
I mean, you might feel tightness too in like the inner thighs and the hamstrings, but that's like a whole other conversation too. But if you can imagine like the muscles around the pelvis, so around the hips, they can also tense up in relation to like what your pelvic floor is doing, as like they do that as a protective mechanism because they're trying to add support and stability somewhere where there's not a feeling of stability. So like if your pelvic floor isn't stable, then your inner thighs might tighten up because they're trying to protect what's happening there. They're like, oh crap, something's happening here. I got to really engage to protect and offset the weakness or whatever that's happening at the pelvic floor. So it could be very well is what I'm saying.
Yeah.
And again, it's an annoying answer of it depends. That's like the phrase of physical therapy, I feel like. Yeah,
I know. And I know here in Michigan, we don't have many pelvic floor physical therapists, so it's often hard for people to find, you know, therapists that specialize in this work. And I remember when I was working in sex therapy private practice, I would bring this up to people and they didn't even know that this exists, right? Like there is a doctor aside from your gynecologist that can specialize in helping you with your pelvic floor. And I think a lot of people don't even understand like what exactly your pelvic floor is and what it does and the purpose of it, you know, because as you said in the beginning of this, we aren't educated about this. We aren't taught how to do a Kegel. It's like we're basically taught not to have sex ever, you know, or you're going to die or get an STD or get pregnant, you know, something like that. And it's like there is very needed to know information out here for women, especially. Yeah, I'm going to try not to go off on my tangent there, but
no, I love it. This is like a daily rant I have as well with, I feel like I get asked a lot because I'm only 27 and I'm doing this and I don't have kids. So people are always like, how the heck did you get into this profession? And like, my short answer is like, my boss is an amazing human and just like pulled me right in when I said I had the teeniest bit of interest. And she was like, all right, here we go. We're going for it. I'm going to teach you everything. And like, has just propelled me into it since. And it's been amazing. But in general, I've always been super interested in it because our healthcare system has a huge disservice to women in this country. And it's so frustrating because one day I might want to have kids. And like now I feel so much more like empowered and more informed on the things that I need to like advocate for myself on and the things I need to be doing to prepare for childbirth and postpartum, even more importantly, because they are pretty good at preparing you for pregnancy and birth now. But it's like as soon as that kid pops out, like after 6 weeks, they're pretty much like done with you. And that's super frustrating for me. I'm like, overseas in Europe, postpartum care in some of those countries is like standard practice. It's included in your healthcare. You go see a pelvic floor physical therapist and like they have all of that ready to go for you. Mm-hmm. So, yeah, and I agree with what you said that like our sex education just sets up the tone for that already. So all of it's just super frustrating, and that's how I got to where I am. So I think we're trying to do a lot better as a profession, physical therapists in general, of like promoting pelvic health physical therapy, and because we like to, you know, promote that to men too. They have pelvic floors as well. Mm-hmm. It's just not external, and they don't deliver babies. So I would say typically they don't know that there's something wrong with it because of those two things. Like women have very good indicators that something's mm-hmm. wrong because things come out or they leak, or, you know, they go through this traumatic experience of a birth and their body is like freaking out because now we have all these hormone changes. So mm-hmm. now I'm going on the rant that you didn't want to go on.
That's okay.
It's a whole thing about how I just feel like we're in a disservice in our healthcare industry, and you're totally right that it's not well known about. But if you can't find a pelvic health physical therapist in your area, or not you specifically, but any of the listeners, I would say seek out some pelvic health physical therapists that do virtual visits. Mm-hmm. That's something we do because there are people out in the outskirts of the DFW area, like in Tyler, Texas, or, you know, whatever, Abilene, that don't have that access because they're in smaller towns. So they virtual consult, and we can still help them that way. Even if you can't get that hands-on work, there's still things to teach and things to help people be aware of and look out for and kind of monitor them and guide people. And so we're trying to be better about promoting it, but it definitely is not as well known. You're so right. Mm. It's frustrating.
Yeah. And thankful, like you mentioned, there are places doing virtual appointments. And now, again, through Instagram and social media, people that just sharing, I mean, great content, exercise videos and things like that, and funny reels and, you know, content slides and things like that, that's how I became more interested in this and wanting to, you know, shed light on this topic more on the podcast and coming across these accounts. And so it's great. So yeah, please tell us about your practice, as well as any other resources that you would offer to people that may not be local to you.
Yeah. So again, I work for Genesis PT and Wellness. My boss, Dr. Becky Allen, started it at the beginning, I believe, of last year is really when she like started gearing up. And so now we have 4 physical therapists, myself included, and an occupational therapist. We do home visits. We do virtual visits. We have prenatal and postpartum packages for people. We see anybody with a pelvis. I even see some people right now who just have a purely orthopedic issue, but they just wanted to double check that their pelvic floor was okay and like have somebody who kind of knew what was going on there just in case, because they had kids recently or whatever. So, yeah. It's wonderful. We're right in the heart of Dallas. And like I said, we're expanding. So exciting things to come soon. You can find out that information on our Facebook or Instagram. The main Instagram page is at Genesis PT Wellness. And then my personal Instagram is at Dr.Amelia, which is AMELIA_DPT.
Yeah, and we'll link both of those in the show notes. And I see on your profile too, you have the Genesis PT Wellness, so I can link them as well. You have lots of things on here as well that we can link for the listeners too. So because again, just the social media resources and things available to people are just amazing.
No, it's amazing. And that's how I found your page. And it's so nice to just like see the things that you're promoting and that you're talking about, because it's helpful for me too to like know kind of the things that you're educating people on as well. Like I know you're not like doing the practice anymore of just pure sex therapy, but it's still good to know. Mm-hmm. You know, you have that knowledge that I don't in that realm.
For sure. Well, I could definitely see us chatting more in the future and doing maybe some, I don't know, videos or something together, some sort of collaboration and episodes and stuff.
Totally. Yeah. I agree. I would love that.
Cool. All right. Any closing advice for people that are listening to today's episode that you want to share with them?
I would just say that sexual wellness and sexual therapy is such a huge component if you are somebody who has painful sex. So seeking out not only a sex therapist or any sort of psychologist, you know, therapist in general, counselor, is a wonderful component to getting past painful sex. And also seeing a pelvic health physical therapist, whether it's virtual or in person, you know, just being an advocate for yourself, because even though it's common, it's not normal is what I would say.
Yes. Thank you. That is a great thing to end with. It's common, but not normal. And there are options out there to help you manage it and even decrease it altogether, which I think people are mind blown to hear. So
100%. Agreed.
Awesome. Well, thank you so much, Amelia. This was great.
Thank you so much for having me. It was so nice to chat with you.
Thank you so much for listening to today's episode. If you loved it, be sure to subscribe so you never miss a thing. And if you loved it so fucking much, be sure to leave a 5-star review. I'll see you next week, and until then, keep owning your sexual self.